All right, now we're recording.
Okay, well, good afternoon, everybody, and thank you for joining our monthly Lunch and Learn. My name is Denise Ramatar. I'm the Outreach Coordinator and Data Analyst for our agency. I'm going to give you a quick background into what we're all about. Next slide, please.
Yep.
The Office of the Healthcare Advocate is an independent state agency, and we provide free services to all consumers in Connecticut who are members of a healthcare plan issued or delivered in Connecticut. We were created in 1999 as the Office of the Managed Care Ombudsman, and our name changed in 2005 to the Office of the Healthcare Advocate. Our mission is to assist any consumers in Connecticut with any healthcare issues that they're experiencing. We have a staff of nurse consultants, attorneys, paralegals, and other professionals. And we're here to assist you. Last year alone, we helped over 2,700 consumers with their healthcare issues in Connecticut. For example, things that we would be able to assist you with if your doctor orders a procedure, but your insurance doesn't think it's necessary, if there's a medication denial or some sort of a CAT scan, MRI denial, we're here to assist you with any health insurance issues. All of our services are free of charge to any consumer in Connecticut. Today, Adam will give a presentation on new state mandates. Please wait until the end of the presentation to ask any of your questions, or you can ask them in the chat. Go ahead, Adam.
Thank you, Denise. My name's Adam Prizio, and for those of you who may not know, I'm one of the staff attorneys here at the Office of the Healthcare Advocate. Thank you for joining me on this first Lunch and Learn of the new year. I'm going to be talking about laws that may affect you that have taken effect on January 1st. So every year, Congress, the US Congress, as well as the General Assembly and the various regulatory agencies make changes to health care, health benefits, and health insurance laws that may impact your rights as a consumer. It's important to mention that some healthcare benefits are only subject to federal law. For instance, what are called ERISA plans or self-funded employer health benefits are purely regulated by acts of Congress and not the legislature. Medicaid as well and veterans benefits are the other three that we see a lot of that are, that are only regulated by federal law.
So I'm not positive what to do when I get these.
Excuse me. Could you just put yourself on hold? On mute, please. Thank you.
I've muted. Thank you. So for federal law, I don't honestly have a lot, but I wanted to talk about a few things. First of all, this year marks the 10th year of the ACA marketplace. So back in 2014, 2014 was the first calendar year in which ACA plans were sold to the public. So we've just begun the 10th year of that. And the big news for this year and for the next 2 years is that the enhanced advanced premium tax credit subsidies, those are the premium subsidies where if your health plan is more than, shoot, I should know this, I think it's 8.5% of your income, you get a subsidy that you can apply toward the premium. Those enhanced subsidies are in effect for this year as well as for the next two. Open enrollment ended on January 15th, which was Sunday. So I hope that folks have all taken advantage of that to the extent that you may have needed to. The other big highlights from last year that have taken effect are from the Inflation Reduction Act of 2022. And those are really all of the ones that I have are Medicare. There is in effect now a $35 cap on insulin copays. There is so that's going to help a lot of seniors who take insulin. It's not quite as low as the cap in Connecticut for Connecticut fully insured plans, but it's still gonna save a lot of folks some money on their insulin. There is also a drug price rebate where the Medicare price of drugs, it grows faster than inflation. The manufacturers are going to have to pay a rebate to Medicare consumers. That's in effect this year. And the Inflation Reduction Act also put some reductions in costs for adult vaccines for both Medicare Part D, the drug benefit, as well as Medicaid and CHIP enrollees. I'm going to admit this person. In Connecticut, there were a goodly number of mandates and changes to coverage. Now, these are for fully insured plans, which are plans that they're what you think of as traditional insurance. All of the plans that are sold on the Affordable Care Act, the marketplace, which in Connecticut is Access Health, those are all fully insured plans. And your employer-sponsored coverage may be fully insured, or it may be self-insured, and that's something that your HR can tell you if you don't know, and you may know because of documents that you've received. But if you're in a fully insured plan, there was a lot of focus last term regarding children's mental health, and so there. Public Act 22-47 was passed into law, and that included a few things. The top one, which is near and dear to our hearts here at OHA, is that the notification of OHA services has to be more prominent in adverse determinations and denials. So where previously, if you received a denial or an adverse determination, they would say down, somewhere around page 6, they would say, and if you have questions, you can, reach out to OHA for assistance. And now there is a call out box. It's right, it's in the first substantive page of the notice that you get that says you can, this is a denial, and you can contact the Office of the Healthcare Advocate for free assistance. Other provisions in this bill that have taken effect are insurers are required to cover 2 mental health wellness examinations per year without cost sharing. There are some revisions to sort of equalize urgent crisis centers for mental health to bring them up to the same level of protections as emergency services. So the surprise billing law, the restrictions on providers collecting more than the deductible or cost share, and some of the other coverage statutes are that have protected people from out-of-network emergency services, billing them a lot of money. Now those apply as well to out-of-network urgent crisis centers. By the same token, the network adequacy inquiry in Connecticut, people keep coming in, I'm going to just allow them in. The network adequacy statute now requires equivalent access to urgent crisis center services as emergency services. So if you can't find an in-network, if there's not enough in-network services, you can complain, or we can complain on your behalf, and more importantly, we may be able to get a single case agreement, or get a service treated as in network. The law calls for no prior authorization for urgent crisis center or for acute inpatient psychiatric services following either an emergency department admission or a referral from a treating clinician. So folks will not get caught up in, having to get a prior authorization, having it get denied, having to have it appealed under this new law. So this is going to increase people's access to these services. My next slide is about Public Act 22-90, which is, and I've abbreviated the title, but basically it's a law regarding breast and ovarian cancer susceptibility screening. And this law, and again, this is for fully insured plans only. Self-insured plans may, but are not required to comply with this. But this law provides for coverage without cost sharing, so no deductibles for baseline mammography and tomography for insured folks who are 35 to 39 and younger if at increased risk, and then annual mammography or tomography for folks who are over 40 or younger if they're at increased risk. It calls for pre-cost sharing coverage of diagnostic and screening ultrasounds if a person has dense breast tissue or if their history has them at risk. And it calls for diagnostic and screening MRIs per American Cancer Society guidelines for insureds who are over 35 or younger if they're at risk. And I've repeated that over and over again because I think this is the best part of the law is that it can be easy to issue a mandate that has an age number associated with it. But we hear from folks all the time who have, they have a family history, they have some risk factors, and so these screenings will now be available to people with no cost sharing if they can demonstrate that they are at risk. It also calls for biopsy of the tissue and for prophylactic mastectomy and reconstruction without cost sharing. The same law, we're continuing on to the next slide, with the same public act. Someone's coming in. Hello. It also calls for coverage without cost sharing for genetic testing for insureds with a family history of breast or ovarian cancer, routine screening and surveillance tests for insureds who are at risk if they're ordered by a physician. And it calls for coverage without cost sharing for monitoring of ovarian cancer subsequent to treatment and for other genetic testing per the United States Preventive Services Task Force, so which is an independent body of physicians and medical researchers and others who issue recommendations for preventative screening and other preventative services. So to the extent that that body finds that these that genetic testings are beneficial, the fully insured plans will have to comply with those findings. The next law that I want to talk about is Public Act 22-118, which extends through age 12 Husky eligibility for undocumented immigrant children. So this is a state-only funding. There's no federal funding available, it's my understanding, but this means that undocumented immigrant children up to age 12 who otherwise are eligible for Husky will be eligible to receive Husky. This same law also allows undocumented immigrant children ages 13 to 19 to remain on Husky, right? So they have to have gotten in already, but they can remain on Husky if they meet the income eligibility and if they are ineligible for other coverage. And finally, this law establishes a community ombudsman program associated with the long-term care ombudsman, focusing on home care services. And we get a lot of calls for folks who have questions about home care or issues with their home care, which is a kind of long-term care. And until this law was passed, the long-term care ombudsman was restricted to nursing homes. So this is going to be helpful to a lot of folks. And finally, because this office has, we get a lot of questions about what are called copay accumulator bans. A copay accumulator, just to back up a little bit, is a way that your pharmacy benefit in your insurance tracks the coupons that you might get, right? So you have a high deductible, your medications are expensive, your doctor or you sign up for coupons that the manufacturers give you, and the coupons, here's, let's say it's a $500 medication and you get a coupon for $400, just to use some round numbers. Your pharmacy benefit in other states has taken the position that you only get the $100 toward your deductible. The $400 that you didn't pay because of the coupon does not apply to your deductible. And in Connecticut, that practice, the practice of keeping track of how much somebody else paid toward your deductible versus how much you paid, has been banned in fully insured plans. However, there are some health plans, high deductible health plans, which are qualified for a tax favored savings account, what's called a health savings account. And if you're in one of these plans, you can put money into a health savings account and save it and invest it tax-free. The IRS is very strict about what these plans can cover pre-deductible. And so some of these plans have argued that being unable to apply a copay accumulator puts them at risk, and therefore puts the member at risk of having violated the tax law by investing in an HSA when they were not in a plan that qualified. Now that argument has some merits and maybe there's arguments on both sides, but in any case, the legislature has seen fit to make an exception, which is in effect this year and is retroactive to last year, to allow HSA qualified high deductible health plans to apply a copay accumulator, while other plans are banned from doing so. That was a lot, but you are welcome to contact us with your questions, and we will do our best to answer them. Next slide is, this is how you get in touch with us. We're here for you. We are, as Denise said, we're free to answer your questions and advocate on your behalf. You can reach us by regular old postal mail at the address on your screen, as well as by calling our toll-free number and by emailing us. So that is everything that I have brought to you today, but I'm happy to take your questions.
Feel free to ask your questions in the chat as well. I put our contact information in there too.
Oh, goodness. There's a question, what is Husky? Husky is Connecticut's Medicaid program. So I should have, I use Husky a lot of the time. Husky is the program where both the state and federal government contribute money toward the care of, for instance, children, folks with disabilities, and others who can't afford their own care, who are below the amounts that they could receive advanced premium tax credits through the exchange. So there's another question, does this session look like one with a lot of proposed new mandates? And unfortunately, the answer to that is that we are, a lot of bills dropped last week and over the weekend, and we are processing them. So right now, I don't have an answer as to the drift of the legislature with regard to new mandates, unfortunately. But I'm happy to follow up with you once I do have that information. I see also a question about the copay accumulator. If you have an HSA with an HDHP, high deductible health plan, will the coupon amount count toward the deductible? And no, and the answer is no. The coupon will not count toward the deductible under this new law because they have created an exception to the ban. If you have a non-HSA high deductible health plan, just a regular health plan that's not associated with an HSA, that's not qualified with an HSA, then the copay accumulator will not be allowed, meaning the amount that you pay and the coupon will both be applied to your deductible. But if you have an HSA qualified plan, under this new law, they only have to apply the amount that you pay. They don't have to apply the coupon amount. It's very confusing. There's a lot of sort of details to this. There's another question, will this recording of today's session be available? And the answer is yes. We can email it out, and I believe that we have started to make these available on our website as well. I'm going to give it another minute for another question or two.
So if you want to put your email address in the chat, I can send them to you. As well as we can make it available in our newsletter. If you subscribe to our newsletter, you'll be able to see previous recordings. And it will be on our YouTube channel as well. So if you put your email address here, I will definitely send that to you. Great, got it.
I just want to say thank you for the work of your office and helping residents of the state and for keeping us informed.
Thank you.
You do a great job.
Thank you. Excuse me. All right, seeing no additional questions, I'm going to thank you again for spending this afternoon with us, and wish you all a wonderful day and a happy new year.
Well,
Thank you.
thank you. Goodbye.
Bye.